This is One-on-One. Dr. Michael Nissenblatt, Associate Director of Medical Oncology, Robert Wood Johnson University Hospital. Good to see you, Doctor.
Thank you.
Put this in context for us. I was looking at the New York Times and I saw a full-page ad about this. It was an award. The Commission on Cancer of the American College of Surgeons awarded the 2012 Outstanding Achievement Award to Robert Wood Johnson. Put that in context. That is an amazingly important award from what I understand, but it's a team award. What does it mean?
Well, the American Society of Surgeons has created a set of guidelines in which they select the finest programs from across the country based upon a set of responsibilities and goals. And these reflect goals regarding leadership of the institution, research, development, and programs, as well as the acquisition of data in our data registry and the translation of that data into improved outcomes, so quality improvement. In the United States, there are 1,500 programs that are approved, but only 79 of them have gotten the ultimate award, meaning that they've not just reached but exceeded more than 30 different subsets of those 4 broad categories of achievement, and therefore they represent a remarkable leadership. In the state of New Jersey, there were this year just 5 who met that Outstanding Achievement Award. In the entire state of New York, just 7, and in Pennsylvania, just 3. So our states nearby are also to be commended. The remarkable thing about Robert Wood Johnson's award, though, is that it represents a unique affiliation, a unique congregation between the institution which we work at every day, which is Robert Wood Johnson, and 2 groups which are flanking them and are responsible for their success.
Is one of them the Cancer Institute of New Jersey?
Well, the Cancer Institute of New Jersey, which was started in 1990, is one of those flanking supporters. And that's the only National Cancer Institute designated institute in the state of New Jersey out of all of the institutions that exist here. And I look upon the physicians who work at the Cancer Institute as clinician scientists, people who take the basic information, the basic knowledge, and do the research in the laboratory, sometimes in animals, sometimes clinical research in humans, but do everything they can to try to translate that to patient care. But they're doing the basic research for care. The second group that flanks Robert Wood Johnson Hospital is the enormous group of remarkably highly qualified and devoted clinician humanists. I consider the clinician humanists to be those doctors in private practice who are committed to taking the information from the Cancer Institute and translating it to the individual patient who can benefit from that in terms of a quality outcome and survival.
Let's break that down. As I was trying to understand this award, and I don't want to make it so much about the award, I want to try to put it in the context of patient outcomes. Because cancer care has evolved tremendously, based largely on technology, research, more information we have. But the outcomes have changed for patients with cancer. I know it depends upon which cancer and which stage and a lot of factors, right?
The outcomes are remarkably different than they were in the past. For example, in 1953, there was a study done at the University of Chicago that only 3% of people with cancer were even informed that they had cancer.
Whoa, do that again, doctor. Say it the year again.
1953.
Only 3% of those with cancer were informed they had cancer?
We had no treatments. We had no chemotherapy. We had no radiation therapy. We had no way to individualize treatment. We would often take an agent off the shelf and administer it to a patient, trying to get a response. Even Babe Ruth was treated with therapy that was a very primitive just a few years before, and soon we'll be coming up with I guess it's the 56th or 57th year of his death. But we had no treatments at the time, so people were not informed. Only 30% of people were cured at that time. Now, 71 out of every 100 people with all non-skin cancers are cured. And when you look at individual cancers, such as cancer of the breast, most people with cancer of the breast are cured with their disease, even with locally advanced disease. Most people with cancer of the colon are cured, whether they have lymph nodes that are negative or lymph nodes that are positive. One of the big One of the big concerns that we've had is that lung cancer has not yet experienced the same kind of burgeoning cure rates as have colon cancer and breast cancer.
Why do you think that is?
But that's because we haven't had some of the information available that we had for the other diseases. For example, we have targets that we can attack for colon cancer and targets that we can attack for breast cancer that we call estrogen receptors or HER2 receptors.
What kind of receptors is the second kind?
These are HER2 receptors, which is a receptor on the surface of breast cancer cells that stimulates the cell to grow. And we have a way of targeting that with a large group of medications now, some of which are called Herceptin, some of them are called lapatinib, and a newer one, which is TDM1. But in lung cancer, we've gotten on a little bit later in the history of the disease. The last 5 years, we have had a tremendous upheaval in lung cancer. We are finding the targets for lung cancer that we now have for breast and we've had for colon cancer. And these targets are things that we can actually isolate, measure, and attack individually, which is the reason that the biology of breast cancer is a crucial structure for us to understand. We can take apart one disease at a time and find an individual treatment for each person. Let me tell you that the modern approach toward treating cancer is not what it was in the past of taking a bomb and waiting for collateral damage.
You mean chemotherapy, heavy radiation chemotherapy, and there's going to be, as you said, collateral damage. While that's still there, what's changed with that?
Now we can select agents which are individually attacking molecules or focused areas of the tumor that open up the sensitivity of that tumor, that expose that tumor's weak sites or weak points and destroy it. I like to think of it as though we were looking for Osama bin Laden in the past before 2012. And when we were searching for him, we would find where he might be and drop a bomb, and we would kill Osama and also a lot of
collateral damage.
But the targeted therapies that we now have represent a way of identifying what cave he is in, finding the specific ventilation ducts, and removing the electricity that activate those ventilation ducts so he's suffocated and there's no collateral damage.
But doctor, in the limited time we have, but it is still always on a case-by-case basis.
It's personalized medicine now, Steve. We have a way of taking each tumor, doing genome-wide assays for the molecules that make that tumor grow, the things that stimulate that tumor, and finding a drug individually active for that patient, not just that tumor. It's a new day. It's a new day in every disease. There is at this time hope for every single malignancies that we are treating. Every single one.
There's hope.
There is extreme
hope. That's not the
hope.
same as a cure, but there's reason to be hopeful, right?
I think there's reason to consider cure in the overwhelming majority of people who have cancer now.
Doctor, we'll keep talking because this conversation is very important, and thank you so much. We'll keep talking off the air.
Okay.
Thank you.
Thanks.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. This program has been made possible in part by New Jersey Institute of Technology.